Hello, this is Erika Hood with another one of our COVID community spotlights. And today we're sitting down with Jessica Morgan, the Chief Programs Officer at the Greater Cleveland Foodbank. And I'm super excited to have you here today to talk about the work that you all been doing now for over like a year and a half, I'm sure. Well, let's say for years, but more specifically during the time of the pandemic. So thank you so much for joining me this morning. And I look forward to hearing more.
Thanks, Erika. Thanks for having me.
So tell me a little bit about the food bank. I mean, if you're from Cleveland, you definitely have heard about this organization, but give us some more background about the org.
Sure. So we have been in operation a little over 40 years. We were founded in 1979 by Ed Worley, by a number of folks. Ed Worley was our first executive director, and have really evolved since then. So we serve 6 counties in Northeast Ohio. We don't just serve Cleveland, even though Cleveland is in our name. Our reach is far wider than just Greater Cleveland. So we serve Cuyahoga County, Lake, Geauga, Ashtabula. We go all the way to Conneaut and the Pennsylvania border. And then we go down south to Ashland and Richland County. There are 12 food banks in the state of Ohio. There are 200 food banks nationwide, and each one of those 200 food banks covers all counties across the country and in Puerto Rico. And so, the food banking network I think is really unique because we have this great opportunity none of us are in competition with one another. We each have our own service territory that's unique to the work that each food bank does, but we do have this great opportunity where we can learn best practices across the network and then adapt those practices and apply them to what we need for our specific service territory and the clients that we serve. So it really is a unique kind of nonprofit. There's distribution, there's accounting, there's IT work, there's programming, fundraising, food sourcing, and program evaluation, all kind of happening under one roof. We are located, on the east side of Cleveland, just west of Euclid. And just north of Cleveland Heights and East Cleveland, right on the Shoreway. We're undergoing a pretty big expansion project right now, which I could talk a little bit more about later on in the podcast. But we serve in our fiscal year 20, which would have been kind of when the pandemic happened. We served a little bit over 400,000 unduplicated people across those 6 counties, which was 100,000 more people than the year before.
Okay, yeah, that's huge. I was just going to ask about that. So normally, let's go back to pre-pandemic. Mm-hmm. You all have distribution services in schools and organizations, as well as folks coming down to pick up things. Is that how that all works?
Yeah, that's a decent summary. So we've got across those 6 counties that we serve, we've got over 1,000 programmatic partners, and we offer 14 different hunger relief programs that we work closely with faith-based organizations to provide emergency bags of food through our food pantry program. We work with other community meal sites who are able to provide a free community meal to community members, but we also have some specific programming for specific populations. We do a lot of school-based programming for children. We do after school and summer meals, and then we also do school markets and backpacks. So those are kind of our 4 key programs for kids, many of which are happening at the school. We also do a number of programs for seniors. We have a production kitchen at our building. And so we're producing a little over 3,000 meals a day for various congregate and home delivered senior programs. We work very closely with the Western Reserve Area Agency on Aging on that. We have a senior box program, which is where we distribute about a 30-pound box of food once a month to eligible seniors. And then our senior market program, which is similar to a couple of other fresh produce initiatives, which is where we bring a truck of fresh produce to a senior-friendly location. A little bit newer to the food banking world is this idea of food as medicine. We've been partnering now with a number of our healthcare organizations, Metro Health being one of them, one of our great partners, to bring healthy foods to low-income patients who have diet-related chronic health issues like diabetes and hypertension, where healthy diets are a requirement for them to keep whatever chronic disease they have under control. So this space is, I would say, emerging. It's still very raw and new, and we are constantly, identifying best practices and learning more every single day about how we can make an impact in this space. But we've got a lot of work to do and really a lot of opportunity to do it.
That's awesome. So 40 years in existence, just about, and the first huge pandemic I have, this was huge, and it was global that happened. So let's go back to March 2020. All of your services are flowing and going. You guys have your niche and your services that you offer. How was that impacted with government shutdowns, when you guys really are one of those organizations that can't say, hold up, we'll be right back, let us figure this out? You guys don't have that, that ability to do that. So how did things look back then?
It's so funny to think that was just about 18, 19 months ago, because it still feels like yesterday when, the world shut down. And we felt the impact of that immediately. I'll talk about a couple of things. One, I'll preface this with saying we're an organization that lives and breathes by planning, by strategic planning. We do a strategic plan religiously almost every 3 years. We set goals for ourselves, and then we develop programming and processes to meet those goals. So here we are, in March of 2020, we are smack dab in the middle of a 3-year plan that was spanning from, 2019 through the end of 2021. So, we kind of found ourselves in this really uncomfortable position from a planning standpoint. We didn't have plans for this. We didn't know how to respond to a pandemic. We have a relatively, I'd say, robust disaster plan, for weather disasters or something to that effect, but nowhere in our disaster plan at the time was an infectious disease disaster. So we really had to get uncomfortable with being uncomfortable. We had to step out of our comfort zone as an organization and rethink how we did things almost on the fly. Another challenge, in addition to just the world shutting down, when that happened, there was a stay-at-home order. So businesses shut down and schools shut down. And we were faced with challenges we had never been faced with before. First and foremost, we rely so heavily on volunteers. We have about 22,000 volunteers a year that come through our doors and help us do what we do. And we could not do everything that we do without the support of our volunteer network. Well, in that first week, we had 1,400 volunteers cancel because they were part of corporations or schools or businesses or just regular volunteers that would come every day. But because there was a stay-at-home order, nobody was leaving their home. And so that was a very unique challenge. And we were very grateful to the Ohio Association of Food Banks and Governor DeWine, who sent in the National Guard. The Ohio Association of Food Banks asked for it on behalf of all 12 food banks across the state, and Governor DeWine signed that order. So we were very, very grateful to have the support. We had about 75 National Guard men and women come to the food bank about 3 or 4 days after that order was signed. And I don't think that we would have gotten through the pandemic without them. They were our lifeline, and I get chills saying that, but they really did become part of our family, and they were with us up until this past July. So we were thinking maybe they'd be there for a few weeks, and instead they were there for 15 months.
Wow. Okay. That's awesome. So
it's pretty incredible. And we got to know many of them. And even after, their deployment, we were able to hire a National Guardsman who now works in our warehouse, and we still contract with a few of them. So that was one thing that happened that was pretty prominent. The other thing was that, as a food bank, we traditionally pre-pandemic didn't do a whole lot of direct service ourselves. Mm-hmm. We had one produce distribution a month in our warehouse where we'd get about 1,000 families each time, once a month. But we only did that once a month. Instead, we did all of our service through our network of 1,000 partners that I mentioned. Yep. Well, when this happened, so many of our partners closed because of the stay-at-home order and everything.
Yep.
And, a lot of our partners are run by volunteers who happen to be seniors. And this was a really scary time.
Very scary, yeah.
Right. And folks needed to protect themselves. So we saw a lot of our emergency feeding programs closed and all of the schools closed. So we were very concerned about where kids were going to get their meals. I think that the schools did a great job, pivoting and doing what they could to serve breakfast and lunch and make that accessible, but we were still very concerned. So, so we started to do drive-through distributions, and we did the first 2 at our building on South Waterloo, and it ended up being not great from a safety perspective. We ended up shutting down traffic in a 3-mile radius. We had traffic copters hovering over our building. It was, for lack of a better term, kind of a mess. And so the city of Cleveland, the Cleveland Police Department, were so gracious and offered the city of Cleveland municipal lot because we needed just a really big parking lot. So we've been there since the first week or the last week of March of 2020 on a weekly basis, every Thursday for the most part. There've been a couple of schedule changes here and there, but every Thursday we are still doing drive-through distributions in the city of Cleveland municipal lot. We had to do one yesterday due to a schedule change with the lot, but yesterday we served almost 1,500 households. So even 19, 20 months, 18 months, I guess, since the start of the pandemic, we are still seeing high numbers through those drive-through distributions. And our network of partners are also seeing the need. Some have really had to change how they serve their community. And that has been great to see, our network of partners adapting to these challenging times. And we're really grateful for their service.
I think I've definitely seen more drive-through distributions than I've ever seen. I'm like, what is all this traffic? And I'm like, food distributions, which is great that community members can access it that way. And then I've even heard about maybe guidelines lifted, where there may have been guidelines before about what area you live in and where you go, or, how much you make. I don't know if that was a shift.
Yeah. There was a temporary waiver instated by ODJFS, Ohio Department of Job and Family Services. They did change the income guidelines. So typically it's we will serve anybody up to 200% of poverty. And those were changed through, they actually stopped this in June, but it went up to 230% of poverty. And then, one thing I'll mention is that we do have a help center at our food bank where people can call and get assistance with a number of things. We could apply for SNAP, submit their application to their local JFS office for them over the phone. And then we can also refer them to other community-based services, whether it's a food pantry in their neighborhood or other assistance programs. And so we saw the calls to our help center almost double overnight. And while, they've come down a little bit, we still have not resumed to pre-pandemic levels. So we are still seeing the effects of this pandemic. I think that we'll still see it for years to come as people kind of crawl out of, how their family has been affected and that sort of thing. So we're here for the long haul.
And speaking of the years to come part, seeing you all now place yourself in this programmatic role, like, hey, direct services lane. So now you've been doing these drive-through food distributions. You guys are kind of shifting how you all work. So tell me this, in the midst of the pandemic, you've had these protocols that may have been in place, not necessarily for a pandemic. What are you going to hold on to? What has worked really, really well that you're like, hey, we really need to think about incorporating this in what we do, or making some shifts and change for the future that can help, I guess, ease another, a transition to something else that may be more catastrophic. So what worked?
That's a great question. I'm so glad that you asked that because there are a number of things that worked. Necessity is the mother of invention. We say that all the time. And so we were able to come up with some really, really great ideas that I think are going to stay around for a long time. And I'll give 3 examples. The first is the way that we source food. So typically as a food bank and food banks across the country, we buy in bulk because it gives us the lowest price. We can buy bulk product, bulk produce, bulk pasta, because it saves us, on the cost of that item. when we are sourcing those items. But one of the things that we saw is that, clients and agencies alike have really appreciated receiving a pre-boxed kind of this box of fresh produce, for example, that has a really nice assortment in it. So instead of going to a produce distribution and getting, a bag of carrots and a bag of potatoes and a bag of apples and a bag of oranges, in some cases, that might be too much for one household. If it's just a 1 or 2 person household, we don't want to create any additional food waste, of course. And so we've been, starting this kind of pre-box program, which, to be honest with you, came out of a program that was launched by the previous administration called the Farmers to Families Food Box Program. And that was a direct result of the pandemic, where the government was purchasing produce from farmers so that farmers, were still supported, and then using that product to distribute through food banks and other nonprofits to serve families in need. The product assortment was great. And so we've been able to continue that, even though that federal program has ended. We've been able to utilize community resources. The community has been so generous to us, where we've been able to source products similar and continue that method of distribution. So we've gotten really positive feedback about that, specifically for our senior population and some of those patients I mentioned through our Food is Medicine initiatives. So I do see that continuing in some aspect. The second example is home deliveries. So when the pandemic started, a lot of individuals were afraid to leave their homes, but still needed resources and assistance. So we have a number of partners in the community who shifted to delivering, which was brand new. And we certainly encourage that. We have some that have made that just a permanent aspect of their program, or have completely switched their service delivery model from a walk-in pantry to strictly home delivery. And so I see that continuing, but also the food bank started a delivery program. And that was, people would call our help center, we would screen them, and then be able to deliver food. That really started when the National Guard was here, and we've been able to leverage the use of volunteers to help us continue that.
That's awesome.
And then the third example I'll give is last summer, we offer a summer feeding program where we typically have about 100 sites. Last summer, that number plummeted to about 55, 60. And so there were definitely communities out there that did not have available services for kids. So we took 2 of our existing vehicles and we essentially changed them into mobile food trucks. And we went out into these communities and provided meals ourselves. And that was so widely popular for a number of reasons that we decided to continue that this past year. And while we had more partners on board this summer than we did last year, so there were more communities that were covered, we still were able to make some direct service stops ourselves. And it gave us some new ideas about how we can provide meals to kids. So I think that, there's a couple of others, but, for the sake of time, I'll use those 3 examples. And, I think that if nothing else has come out of this pandemic that's positive, it has given us the opportunity to be really creative and thoughtful and try some new things that normally we would have planned for and budgeted for and not been able to just kind of do. But we found a lot of success in that.
That is awesome. I do like that. I do, once you see people with the drive up, open up your trunk, we'll put all of the, items in your trunk. You have to think about folks who don't have the ability to come, in a car. So the home delivery, I think that's huge that you all are able to cover a lot of folks at home, which is great. So you talked a lot about volunteers, and I always ask this of my community organizations. What is your ask of community members? How can people help the food bank right now? What are some ways that we can stay connected and definitely support you all?
Thank you for asking that. So, there's a couple of different ways. One, the easiest way is to donate. We can make $1 go pretty far, and we use this phrase: $1 can provide up to 4 meals, or $1 can provide up to $10 worth of groceries. So, we are always appreciative and gracious, even if it's just $1 that folks can give, or 5 or whatever. We are so grateful for the generosity of our community, and they have definitely stepped up in the past year and a half. The easiest way to donate is via our website, which is greaterclevelandfoodbank.org. But we are always in need of volunteers. Volunteering at the food bank, there's so many opportunities to get involved. We have a giant room, which we call our repack room when you enter our building. And it's essentially where we do a lot of our repackaging projects. We build senior boxes, we build disaster kits, which is a shelf stable box we started to distribute because of the pandemic. We pack backpacks, we sort product. And we need volunteers in that space. We've put together some really, really strong safety measures in place to make sure that people are safe when they come here. You know, everybody has to be masked and socially distant. We sanitize everything. So we want our volunteers to feel comfortable. I mentioned our production kitchen. We make children's meals and senior meals every single day. And we're also in need of volunteers to help us prepare those meals. While we do have a full-time kitchen staff, again, when you're making about 6,000 meals a day, the work of volunteers is really crucial. We are still in the Muni lot every week. We are still down there every single week. And we need about 75 to 100 volunteers every single week down there to help us execute that distribution efficiently and safely. And it's a great way to talk to folks, you know, to meet new people. You get to stand outside. I know we're entering the colder months, but you know, you're not sitting behind a computer, you're outside and you're interacting with the community. And so we really find that to be a fan favorite. And then, you know, we are always in need of just skill-based volunteers. So sometimes there's a project that comes along where we might need somebody who has a specific skill set to help us. And we post those opportunities on our website. So, you know, again, I can't say enough about volunteering. It's fun. We'll take care of you. And I promise that, you know, you'll leave with a full heart about the work that you're helping us with.
Awesome. Awesome. I also asked this question, which may catch you off guard, but if you have a message to share with the organizations and the volunteers that help you all do what you do, what would be a quick message that you would want to send out to them?
You know, I hear a lot of client stories and I hear a lot of really positive feedback about, you know, how that bag of food has impacted somebody's life. And while, you know, you and I and others might take that for granted at times, you know, the fact that we can go home and open up our refrigerator and we've got food in there, that's not always how it is. And, you know, hunger doesn't discriminate. You don't know if your neighbor is struggling. You don't know if your family member is struggling. Like hunger doesn't have a face. So I would just encourage people to think about the impact that they're having when they are here helping us or when they are making that donation, that, you know, you truly are, even though you're doing it for maybe 10 steps behind, you truly are making an impact in somebody's life. And the positive stories that I hear about how, you know, that bag of food has impacted that client and the stories that those clients have about how they got to needing that bag of food are truly inspirational. So I would just, you know, thank you is an easy way to say it, but just really recognizing the impact that you do have any way that you do get involved with the food bank. It is appreciated beyond words.
Jessica, this was great. Thank you. I don't know why I'm early morning and I'm just so emotional. This is a great interview, but thank you so much for sharing you guys' great work. And we'll definitely help push this message of the need for volunteers and just to let people know that there's an opportunity to connect. Some folks do come to us and ask, you know, are there ways that they can give back or help out any of our community organizations? So this is great to know.
Awesome. Well, thank you so much for having me.
Thank you.